really happy to just be talking more about charting and about what our charting can help us access in terms of medical management when issues do arise. So please just remember that anything that we discuss tonight should not be considered medical advice. You should please always be certainly consulting your doctor or a FEMM medical provider if any issues do arise for you. So you can go on to the next slide, Sarah. So my name, just to introduce myself, is Ulrika Drevnock, and I'm a registered nurse, and I live on Vancouver Island, which is on the west coast of Canada. And I live here with my husband and children. I trained as a fertility awareness teacher back in 2020, and I'm so thankful that I found FEMM and that Sarah found FEMM as well, because it's a science and evidence-based program. And it has an incredible network of healthcare providers that are able to interpret charting to assist women to meet their health goals. And so it's a really wonderful community to be a part of. So tonight, really, Sarah's going to introduce herself in a second, but our objective tonight is really to understand that central role that hormones play in reproductive and overall health. And really also, of course, to learn how charting can be used as part of a medical management process to identify those root cause issues that women sometimes face.
Like Ulrika said, I'm Sarah. I live in Montana, so also kind of in the mountains. And I also got FEMM certified in the last couple of years. Ulrika might have mentioned this, but we're both registered nurses, and I've always had a passion for this type of women's health, restorative women's health. And so this is just a wonderful program. As Ulrika mentioned, the FEMM method is what we teach. There are multiple methods of what we call fertility awareness, which is learning how to track your body through biomarkers, and we'll discuss this tonight. But again, the FEMM method, as a nurse, it's really important to me that good medical management is available to patients as they are working through learning how to chart. So again, I'm a mom. I have a couple boys. I love women's health, and we are just like the dynamic duo. We love working with each other and bringing this information to you. So we're just happy to be here. So TrueFem, we are all about elevating women by enriching health. And so what we're going to really focus in on tonight is, number one, hormones. How do they work in your reproductive system? Right? We've heard about women being hormonal on their periods. Let's get over that. Let's talk about, like, why do we have hormones? What do they do in the body? And specifically, how do they point to our overall health? We're going to talk about biomarkers. How do you actually track your hormone activity? That's the question we want to answer for you. And then we're going to talk about how charting reveals hormone imbalances, and how, as a patient, you can actually interpret that in your own charting. And that charting can then be used by a trained physician to guide testing. We have a case study that will really kind of showcase a real patient of one of ours that worked through the FEMM process. And then we're going to talk about at the end, how can you get started doing this for yourself and working with somebody. So let's just dive into this because it's really exciting. Reproductive health is controlled by hormones. I know that's shocking, but you can see this picture over here to the left. And what we really want to highlight is this brain reproductive system connection. They are very intimately connected, right? The brain is constantly talking to the ovaries, and the ovaries are responding over the course of a cycle. The brain is really what signals our ovaries to mature an egg and produce those main female hormones, estrogen and progesterone, right? We've heard these terms before. And like I like to tell people who work with us, that hormones are what I like to call chemical text messages that direct activities in the body, right? So estrogen and progesterone for women are really important, and they influence the reproductive system and the entire health of the body. And that is a really special point that we need to understand. These hormones affect the entire body, right? So we'll go back to 6th grade here. Here's a little schematic of our reproductive system. You can see the front view here. Can you guys see my mouse? I hope so. You see that front view and the side view. So just a quick anatomy recap. We have our ovaries here that are sitting on both sides of the uterus. You have these fallopian tubes on each side as well. And if you take the course, we will go through each of these pieces very in depth, right? We like to talk about all the parts. But what I want to draw your attention to here is the uterus, and then the lower part of the uterus being the cervix, okay? Obviously, as women, if you've had a menstruation, you know that the uterus itself is something you're very aware of every cycle, right? With bleeding and whatnot. But what we really want to talk about tonight, and this might blow your mind, maybe. It blew my mind the first time I heard it. But the cervix in particular is this genius organ, right? You can actually notice the mucus that your cervix produces throughout a cycle. And if you didn't know that your cervix produces mucus, you do now, right? It's a very healthy thing. And if your cervix is producing mucus, we are very happy about that. That is a sign of health. It responds to chemical text messages throughout the course of the cycle, specifically estrogen and progesterone. And spoiler alert, you can actually describe what hormone activity is taking place by looking at cervical mucus. Okay, so keep that in mind as we kind of move along through this. We're going to get to that in a minute.
So each cycle, there's an interplay of about a dozen hormones that work to create the ovulation cycle. But for the sake of simplicity, we'll just focus on 4 of those hormones tonight. Follicle stimulating hormone, that's called FSH, estrogen, luteinizing hormone, LH, and progesterone. And so a healthy reproductive cycle really requires each hormone to reach a certain level in order to stimulate the release of the next hormone. So it's really like a domino effect where each one has to be at a proper level for the cascade of hormones to properly play out over the course of the ovulation cycle. So in each cycle, FSH stimulates an egg to grow, and that growing follicle is what produces lots of estrogen. And when that estrogen level peaks, that signals back up to our brain to let our brain know that it's time to let luteinizing hormone be released. When luteinizing hormone is released, LH, that is what allows for ovulation to actually occur. And that's what you can see in the slide there where Sarah's pointing to. When that egg is released from the follicle, that is the event of ovulation. And that event of ovulation is what we're looking for each and every cycle. And that is why we refer to it as the ovulation cycle, because that's really the sign of health that we're looking for in terms of the cycle. So once ovulation occurs, we know that the shell of the follicle starts to pump out progesterone. And where you can see Sarah highlighting with the mouse right now, that is that shell of what used to be holding the egg in before. Now it's called a corpus luteum, and it actually pumps out progesterone to the rest of the body, and that's produced after ovulation. And so you see on the graph, the gray line is progesterone in being dominant in the second half of our cycle. Whereas in the first part of our cycle, that blue line of estrogen is mostly dominant. We do, of course, see that there's a little blip of estrogen rising in the second half of the cycle. That's just because the corpus luteum also does produce some estrogen. But really, for the sake of simplicity, it's enough to know that estrogen is dominant in the first part of the cycle and progesterone is dominant in the second part of the cycle. So that event of ovulation really indicates that each hormone in the sequence has done what it needed to do in order, has reached the level that it needed to reach in order for the whole cascade to play out. So yeah, as we were saying, we really do like to call it the ovulation cycle, since ovulation really is the central event of the cycle and menstruation is the result of that. So once the reproductive system has fully matured, an ovulation cycle occurs approximately every 24 to 36 days. So Sarah will show here on the slide how FSH acts from the brain down to the ovary to start that follicle growing. Once that follicle reaches peak levels of estrogen, estrogen will then feed back up to the brain. The brain will then say, oh, okay, it's time to turn on LH. LH will come to the ovary to tell the follicle to release that egg in ovulation. And then the follicle casing will become the corpus luteum and progesterone is then pumped out again. So an ovulation cycle occurs approximately every 24 to 36 days. And each healthy cycle typically releases one egg. Of course, we all know there's cases of twins, and in those cases, the eggs are released essentially within minutes to hours of one another. But for the most part, only one egg is released each cycle. And a woman's body is then prepared to achieve and support a pregnancy. So ovulation is really a sign of a healthy cycle, but also of a healthy body. So this is a great chart that FEMM has provided us with that really shows how estrogen and progesterone affect the whole body. And we know from what we have just been hearing that both estrogen and progesterone are required at sufficient levels in order to affect our reproductive health, but also actually to affect the health of our entire bodies. So they balance each other's work in the body. And in general, we could sort of say that estrogen is the hormone that proliferates, that tones, that forms, that energizes. So it's really our energizing or our building hormone. Whereas progesterone, on the other hand, has the effect of more like normalizing or relaxing. And so it is the maintaining hormone. So it maintains structures that have been built, or can also have the effect of relaxing certain structures. So both estrogen and progesterone are needed in the body cyclically at certain levels over the course of a cycle for healthy physical well-being and also for healthy mental well-being in a woman.
I don't know if that blew your guys' mind, but it blew my mind the first time I realized that, because the truth is like, we're always seeking balance in our life. And sometimes you wonder, like, why is my workout feeling so hard, right? Or why am I feeling like I just need to veg today? And it's really interesting to be able to see how your hormones really sync with how you're feeling holistically. So as you know, Ulrika has said this, and by the time you leave tonight, if you remember nothing else, this is what you're going to remember, that ovulation is a sign of health. Right? And you're going to start talking about your cycle as your ovulation cycle, just because you learned this, and it's going to be great. So your body is communicating clues every day about what the status of your hormones is, and whether or not you're close to ovulating in your fertile phase or in an infertile phase. And as Ulrika mentioned, what's really cool about tracking your cycle is that you can see this progression happening, right? You can see your body preparing for ovulation, and you can track that hormone activity. So it gives you an indication of where your health is in real time. Okay, so I think that's a really cool takeaway for learning how to chart your cycle. So over the course of a cycle, you will see a couple things. And when we talk about biomarkers, I want you to think about bio meaning life, marker being sign. Right? So these are life signs. And we talk about in nursing, and you guys have gone to the doctor and had your blood pressure taken, your temperature taken, your respiratory rate, all of those things, right? Well, for women, the health of your cycle is a vital sign, because what it's telling you is what the hormone activity is going on in your body and if it's sufficient or not. So it tells you in real time using a few things, right? There's a few things you can observe to correlate to that hormone activity. One of them is cervical mucus. And I often tell a lot of people, again, the concept of mucus is probably not something you're used to thinking about as a healthy thing, but it's absolutely a sign of health to have healthy mucus, right? So mucus and bleeding are the signs that you are looking for on a daily basis to give you clues about your health. So a little bit more about that. We like graphs. I like pictures. I hope you guys do too. So let's orient you to this picture here. On the top, if this was the inside of your ovary, what you're seeing is a growing follicle right here, right? You're seeing this growing follicle and inside an egg that is maturing, and it's reaching the event of ovulation somewhere mid-cycle. So I hate to say typically around day 14, because that's not the same for everybody, but for illustrative purposes, it's somewhere in the middle of the cycle. And then what we see, as Ulrika had mentioned earlier, this luteal phase where the corpus luteum, which is that empty follicle, is now the second half of the cycle. So the first half is dominated by this follicle growth in the ovary, and the second half of that cycle is dominated by the action of what's called the corpus luteum. So we've isolated these two hormones so you can see, right, as this follicle is maturing and the egg is maturing in the ovary, we see this rise in estrogen. You see this blue curve, right? So as we approach the event of ovulation, what we can anticipate is that you will have higher and higher levels of estrogen circulating through your body, okay? So the question is, what does that do to your mucus? There's the question, right? So this is super cool. I get really nerdy about this. Let me show you. So if you look down here, we're going to focus kind of on these two spots right here. As the estrogen in your body is rising, we see under the microscope, if we were to take a sample of cervical mucus at the very beginning stages of that estrogen rise, it would look something like this. This is what we call EL mucus. And the reason we call it that is it looks like, right? It looks like lobes or leaves under a microscope. So this formation is what we call estrogenic lobes or leaves. That's kind of what we're thinking of. And the purpose of this mucus in particular, this type, is to filter out malformed or malfunctioning sperm. It's actually a genetic filter, which is really cool. Your cervix is a genetic filter. I think that's just blew my mind. First time I heard it, tell you what. I do this all the time and it still blows my mind, right? And then we have this really high level of estrogen, and we'll see this around the time of ovulation. Most women experience this as a very slippery sensation when they wipe. The mucus might literally look like raw egg white. That's how you kind of know you're getting close to this event of ovulation. If you were to look at it, the mucus under a microscope, it might look something like this. And we call these strings, right? Or I like to call them superhighways. So ES, estrogenic strings. And this type of mucus facilitates fast transport of sperm to an egg in waiting, right? After ovulation has occurred, because time is of the essence, right? After ovulation occurs, that egg is only going to live for 12 to 24 hours. So this mucus facilitates fast transport, right? These two mucus, again, they're kind of secreted simultaneously, but there are ways that we teach you to kind of differentiate between the two during your cycle. What's important to note that this is a time of fertility when you see estrogenic mucus. What we see over here with this progesterone curve, we kind of switch gears. We've seen ovulation happen. Now we have this uptick in progesterone. If you were to look under a microscope at progestogenic mucus, right, progesterone dominant mucus, it would look like this. I like this. Looks like a brick wall, right? Nothing is getting in to the body. It's literally like a mucus plug. The body, the cervix plugs off. And the reason it does that is this: if there is a life in the uterus, if there was a embryo formed, then the body is sealing the door. Nothing is going to get in there, right? It's antimicrobial mucus plug, and it functions to protect the inside of the uterus. So what we see is this kind of starts to fill the cervix in the second half of the cycle because of the progesterone, right? Now, the question is there a pregnancy or not? If there is no pregnancy, what do you see here happening? You see this falling of the hormone curves, right? Because this corpus luteum starts to degrade and all the hormone activity starts to drop off. This is what causes a period, is the falling of the hormones, estrogen and progesterone, is what signals the body to menstruate, right? So what we see, if we just look at this holistic picture, the beginning of a cycle, we see progesterone's kind of this dominant hormones left over from the last cycle. This is what the mucus might look like under a microscope. And then we see this change in mucus as you go throughout your cycle, especially around the event of ovulation. Okay, I could talk about this slide for about 3 hours. So I'm going to go ahead and move on so Ulrika can talk a little bit about like what are we seeing here. So
Great. So now that Sarah's reviewed all of those mucus biomarkers, we can see that the changes in those biomarkers reflect the hormonal changes that are going on inside of our body. So a typical cycle will have bleeding in terms of menses, and that's really the sloughing away of the lining of the uterus, and that is due to the falling of both progesterone and estrogen at the end of the previous cycle. Then we typically have a few dry days. So we see that there on the chart, and that is due to just a very, very, very small amount of residual progesterone left over from the previous cycle. It's enough to cause some dry days right after bleeding, but generally it's just a very quiet time for all of the hormones before anything starts to get ramped up. Then we see that there's an increase in fertile mucus as we approach ovulation. So that follicle stimulating hormone has told the ovary to start growing a follicle. And as that follicle grows, it starts to pump out estrogen. And we see that there is the beginning of that EL mucus, that medium to high level estrogen mucus, followed by that ES mucus, which is the very, very highly fertile type of mucus. Then, of course, after ovulation, we see that it is followed by many dry days again, G mucus again. After ovulation has occurred, that is all dominated by progesterone, and that is really what causes that post-ovulatory dryness in our cycle. So our bleeding tells us just how well all of our hormones worked together in our previous cycle. So it is not foretelling the future at all. It is really saying this is like a report of your last cycle hormonally. And can you read this report? We're going to go over at the end what proper cycle parameters are, and we'll find out what a healthy bleeding pattern looks like. That cervical mucus that we see, that EL and that ES mucus, that really reflects changing hormones and gives us a clue as to the events that are happening inside. So the follicle growth, when the LH surge occurs, and then when that corpus luteum is formed to produce progesterone. So it is very important to note that when you're having other symptoms that accompany your cycle, like headaches, breast tenderness, mood changes, cramping, fatigue, all of these can point to a hormonal imbalance. So we do need to start thinking about the body as an integrated whole. And that is sometimes a bit of a paradigm shift for a lot of people because they've been told, oh, like it's very normal to have cramps. Everybody gets them. It's just part of it. And we're here to tell you that while it's very, very common, it's not necessarily normal. So a low amount of symptoms in the days leading up to, in only a few short days leading up to your menses can be normal, but not many symptoms, and certainly not for many, many days. So those are something that, or that is something that people who start to chart often really are able to dial into. And it's a beautiful form of self-care because it's really just asking yourself at the end of the day, yeah, how did I feel today? Like, how was my mood? Did I have any headaches today? What else was I experiencing today in terms of the rest of my body? And what is my body trying to tell me about what my hormones might be doing? So the mucus biomarker really does change over the course of the cycle. So peak day, as we see here highlighted with a big P over top of it, is always the last day of any ES mucus that we see in the cycle. So that ES mucus is the mucus with the highest fertility, and the last day is what we call peak day, and that is our best approximation of ovulation based on cervical mucus observations. Obviously, in a physician's office with an ultrasound, things are different. You can see different things, but we don't all have access to an ultrasound every single cycle. So we have our mucus biomarker to tell us what is going on in our body, and it's quite amazing. And it's interesting to note also that as our cervix ages, those number of S and L crypts in our cervix, so the actual parts of our cervix that secrete ES mucus and EL mucus, actually start to decline. So this causes you to have fewer and fewer days of estrogenic mucus as you approach your mid-40s. And we know from the work of Dr. Eric Odeblad that for every year that you take a hormonal contraceptive, your cervix essentially ages a year or two, and it's actually more pronounced the longer that you take them. But pregnancy can have the opposite effect. So it can actually essentially reverse the aging process on the cervix by about 2 to 3 years. And that's all from Dr. Eric Odeblad, who was a Swedish physician and researcher into cervical mucus.
So we're going to kind of take what we've learned. Again, there's a lot here. So if you're a little overwhelmed, again, I'll send out this recording so you can review it. But what I want to show you here is a chart. We're going to talk about it because what I want to help you see is that the observations that you make of the biomarkers of your body, cervical mucus being the one we're mainly talking about, as well as bleeding, actually correlate closely to the lab values that can be drawn to evaluate it, right? So some people are saying, I'm just looking at mucus, like how does that actually tell me anything? Well, I want to illustrate to you a couple things. I think this is pretty cool. So first, let's look at this chart on the top. This is the, let's say, the perfect chart, right? I hate to like show people this because they say, that's not how my cycle looks, right? They kind of get a little worried about it when you first start charting. But we have to have some benchmark of what normal is. I'm going to put that in quotations, normal, so that we have a way to kind of evaluate the health of a cycle. So here's that like FEMM chart that we kind of use as like the basic. If you look at this chart, there's a couple things that you might notice, right? And again, I'm kind of going to walk you through this because this might be the first time you've ever heard this. But what we see here is a pretty light menstruation, right? We see brown bleeding here was what you can see that brown here. We see a lot of fertile mucus, lots and lots and lots of fertile mucus. And we see our peak day here, which is the last day of the ES mucus. And when we see peak day, or we say peak day, what we mean is that it's the approximate day of ovulation based on cervical mucus observations. Okay, and then what we see in this phase right here, look down here, we really would hope to see a little bit more dryness here, right? But what we're seeing is fertile mucus observations still, not peak type, but we see still fertile. And then we see what's going on here. We see spotting, we see brown bleeding, we see a fertile mucus observation, and we see a cycle that's 27 days long. So still within normal, but a little bit on the shorter side, right? So again, there's a lot of things going on here. So if we were to dissect this and actually take labs, which is what I want to show you, we would see this pattern reflected in the lab work. Okay, so this cycle is the cycle, I'm going to highlight which labs were drawn. So this is what we call the pre-peak day, let's say pre-peak day estrogen levels. Okay, so this is the patient's estrogen level curve here, right? This is a high normal curve, this is a mid-level range curve, and this is a low normal. So what we see here, and the boxes are highlighting the days that those labs were drawn in correlation to peak day. So it's interesting to note that this person actually has pretty adequate estrogen levels, right? We're definitely within the curve range here. What we are noticing though, is that they actually ovulated right before the peak day. You see this spike here? So that's pretty cool. So we can tell in this person's body, they actually ovulated within the range, right? We talk about this in the training that we give the women that we work with. There's a window of time that ovulation is likely to occur. So that is happening here. I want to draw your attention to the next slide though. Whoops, sorry. Got a little crazy there. This is the progesterone levels. Okay. So here's this woman. This is her first lab here. Starts here. This is that mid-level progesterone curve, low-level progesterone curve, high-level progesterone curve. Look what's happening, right? First day, first lab. Second day, lab here. Third day, third lab, I should say. You see this drop, right? So it's still considered like really barely normal, right? It's low range. And then look what happens. Boom, boom, total drop off. And what's happening here in her biomarkers, right? We start to see premenstrual brown spotting. And that can be a sign of low progesterone. So if I was the educator and I was looking at this woman's chart, even before I even saw the lab values, and I see this type of signs, I see spotting right here. I see a short phase. This whole phase seems a little short. If I see spotting or brown bleeding before the period actually starts, or like fertile mucus observations, I already have a sign that something's up. So these lab values further show you that this person, right, what we're seeing here is actually correlating to the lab values that are being drawn. So again, the reason I bring this up is because people would say, what's the big deal about cervical mucus observations? But the big deal is it actually correlates very closely to the actual hormone activity that's going on in your body. Okay, so that might, I hope, see, this is the last one here. This woman also, you can see, this is estrogen levels in those same days. And what you see here is lower estrogen levels, but still within normal. So what that tells us is that what is happening is definitely predominantly a progesterone problem, right? And why would we want to correct progesterone deficiencies? The main reason is because if you're trying to achieve pregnancy, it's hard to maintain a pregnancy if you have low progesterone levels, first of all. Very high rate of miscarriage with really, really low levels of progesterone. But secondly, again, we talked about overall health, right? Progesterone balances the effects of estrogen in the body. So a lot of people that see this type of stuff in their charting, it's not unlikely for us to also see notes about PMS, cramping, anxiety, a lot of those things that kind of go along with progesterone levels declining very rapidly or being inadequate. So that tells us a lot, not only the cervical mucus, the notes about how the overall health of the person is, and then we can correlate that to lab values. Just think about if you took this to your OB. Would that blow their mind? I would hope so, right? Okay, so I'm going to just kind of stop it there because I could get really into that, but I want to have Ulrika have time to show you kind of the next one here.
So as Sarah and I said at the beginning, we're both just so glad that we trained as FEMM teachers, because FEMM stands for fertility education, but the MM stands for medical management. So when we have clients who present with issues in their charting, we actually have somewhere to go with these issues. We can refer our clients on to a whole network of healthcare providers who will be able to interpret their charting and order tests based on what they're seeing in their charting. So this is so important because we don't want women just charting and charting and charting and thinking something's going to get better because I'm charting. That's actually not the case. Often with a very, very small tweak in something, a woman's health can improve a lot. She can reach her health goals and she can regain her hormone function. So it's very important that we have this capability to refer to this whole network of FEMM healthcare providers. And it's especially prominent in the US, but it's actually global, which is amazing. So FEMM healthcare providers, of course, work based off of 6 pillars. The first 3 are, typical to any healthcare provider: clinical history, a physical, and then general laboratory tests. Where FEMM medical providers are different and where they're trained to be able to interpret they interpret the cycle charting that their patient will bring to them based on our good teaching of them as FEMM teachers. They will order something called the basic hormonal profile, and that's a series of lab tests that lets them know from a physiology standpoint what is going on in this woman's health. And then in many cases, they will also order a gynecologic ultrasound from that as well.
All right, I'm not going to go through all of these, but what I want to illustrate to you guys is that we talked about 4 hormones, right? FSH, LH, estrogen, progesterone. But there are a lot of hormones systemically from different parts of the body that all have to kind of work together and be balanced in order to produce a domino effect, which is your cycle, right? And ovulation, the main event. So if you ever see a FEMM doctor, they are going to order a lot of lab tests if something's off, because they are going to figure out what it is. And they're going to look from head to toe for whatever the root cause of the issue is. So again, they're going to look at estradiol and progesterone, because what that demonstrates is ovulation occurring, right? Are we having adequate luteal formation or corpus luteum formation? They're going to look at FSH and LH because they want to know, is the brain and the ovaries, are they communicating well? And are the ovaries responding? They're going to look at prolactin and then a couple other building blocks in hormone transport proteins, because they want to know, are the hormones getting used up somewhere, right? Or are they not being transported well? They're going to look at your thyroid in depth. Again, this is a little bit of a diversion from modern medicine, is they're going to look very closely at the thyroid, because poor thyroid function means poor ovulation. Those 2 things are very intimately connected. They're going to look at your balance of male hormones as well, right? Women do have testosterone in our bodies, and we want to have the right amounts. They're also going to be looking at cortisol. What is the stress and how are the adrenal glands responding to this, right? Is the body in a fight or flight mode? That's important to note. And then really important, again, something that is not screened very well in modern medicine in women's health is looking at glucose intolerance. If you've ever done a glucose test, sometimes they'll make you drink this gross stuff, like a really sugary drink, and they're going to check your labs, throughout 3 hours or so to see how does your body process sugar. But the other thing that FEMM does that's different is they also say, how does your body release insulin? They also want to look at that gentle interplay of those two hormones. So again, look at this whole picture. There's a lot of hormones involved in this whole thing we call ovulation, which is a sign of health. And we really want the body to be ovulating if you're in reproductive age. That's really, really important. If you haven't quite seen how passionate we are about ovulation by now. So monitoring the cycle enables recognition and early treatment of these gynecological, endocrine, metabolic, and infectious disorders. It's like real-time information about what's going on in the body. And what is different here is that evaluation and treatment should be targeted specifically to that person's body, to their hormone activity and the cycle events. Dr. Pilar Vigil, she's the mother researcher of FEMM. And one of the things that she talks about is that early diagnosis of these alterations will not only improve fertility disorders, but it may help in the diagnosis and treatment of other pathologies, like we just described here, right? Even cancer down the road. So the prevention of diseases that women struggle with later in life, it can be prevented just by this type of monitoring, which is super, super empowering for women to have that information at their disposal. So again, this is not just about achieving fertility goals. It's really about health monitoring, which is very empowering for women to have. So this is cool. This is a clinical picture. I'm giving it to Ulrika. This is a real patient. It's a real one. The last one was real too. This one's real too.
This is a real life case study. So this was a female patient, age 23, and some of her complaints were fatigue, cravings, weight gain, headache, hirsutism, which is unwanted hair on the body in perhaps in places where it's not supposed to be, sleep apnea, low energy, and low mood. And as we see on the left-hand side of your screen there, her charting demonstrated really long, irregular cycles. So there were mucus patches, but no clear ovulatory pattern. And there we see that there's that brown bleeding before the start of her next light or medium bleeding, which may or may not have been a true period because we actually can't see here that ovulation is occurring. So there's a big question mark here. Is ovulation actually occurring in this woman's charting? What could the root cause hormonal imbalance be that might be preventing her ovulation? And what other systemic issues are at play? So this client was actually able to access a FEMM trained provider who was then able to put those RHRI protocols in place for investigation. So we're not going to show you anything about the gynecologic ultrasound, but we'll show you a little bit more about what was found after she had some blood work done. So this was the chart that she had, the cycle that she went for blood work. And what we saw in this charting and from the blood work that was done, it revealed that insulin resistance was a root cause problem for this client. So she had elevated triglycerides, elevated cholesterol. Both of those can be markers of insulin resistance. She had an elevated C-reactive protein, which is also a marker for systemic inflammation. She had an elevated fasting insulin and a fasting glucose. So both of those are markers for insulin resistance as well. She had an elevated reverse T3. That's a thyroid hormone. And then she had high androstenedione, DHEAS, and then free and total testosterone. So that's when Sarah was talking before about male hormones that are investigated by FEMM-trained providers. Those are some of those hormones. And that would be leading us to think that there's something going on here with somewhere on the polycystic ovarian syndrome spectrum. She had low sex hormone binding globulin, and then she had a relative zinc deficiency, low vitamin D, and low omega-3 index. So what was the plan of action from a FEMM approach? Well, it was to treat the insulin resistance. So using both prescription and supplement support, she was to follow a low glycemic index diet, avoid sugar, follow a cardiometabolic food plan, and support her thyroid health with her foods as well. She also had to start some specific supplements to support her insulin balance and reduce her androgens. That was also hoping to improve her thyroid function, to decrease inflammation, and to improve her immune function overall. Now, the direction that she was left with was to repeat her labs in 3 months' time and then follow up with her provider. Why is that? Well, because of the way that our brains and bodies take time in order to produce certain of our hormones, we need those 3 months in order to fully see where the change is. And so there's an androgen dependent stage and an androgen independent stage. And so that we need those 3 months in order to see if these medications are actually doing the trick, doing the thing that they're supposed to be doing. So what were the outcomes for this client? Well, we see along the top of the slide here, this is how her cycle looked after 3 months of treatment. So we see some really good outcomes for this client. We see a cycle length of 31 days. And if we compare that to what we were seeing before, we were up in the 60s and 70s with that cycle and previous cycles. So this is totally within the range of normal for FEMM. A FEMM cycle length parameter is anywhere from 24 to 36 days being considered normal. So we're super happy to see a 31-day cycle in this client. Then for her days of menses, she has 6 days. And our cycle parameters in FEMM are 3 to 7 days with at least 1 day of medium or heavy flow. And that's exactly what we see in this patient's chart. Then in her fertile window, we see she's got 2 days of fertile ES mucus, as well as 2 days of EL mucus, most likely being one of those days. And so we really are happy to see that she's getting what looks to be like more ovulatory pattern in this cycle. So something that is looking like ovulation may be occurring for this client. And then how else do we also tell that? Well, we look at her luteal phase and we see that her luteal phase is 13 days. So having a luteal phase that's within the range of normal also tells us that a corpus luteum was formed and is able to pump out that progesterone and cause those dry days for anywhere between 9 to 18 days being considered our normal parameters for the luteal phase. So seeing this change, this is all trending in a very positive direction for this client. And she was, of course, thrilled to see that her cycles were becoming more normalized, her overall symptoms were improving, and these were all amazing outcomes for this client.
And she's still in the process of making those life changes, right? So we'll have to stay tuned and see kind of how this charting plays out. But typically when people can find the root cause issue and you can treat the root cause issue, you see wonderful outcomes for people, not only like, let's say, a cycle pattern that looks better, but we're also talking about losing weight, right? Getting rid of the acne and the hair on the face and some of those things that really cause pain for people. So this is bigger than just having a pretty cycle. It's really about achieving overall and optimal health. So you're probably a little bit overwhelmed, and that's okay. We were here for you. So the first thing I want to say is, like, what can you do to be proactive and start if you're at that place and you're like, I want to like figure out how to do this for myself. So the first thing I want to tell you is there's a really good user-friendly FEMM app. It's called FEMM app. I put the website on here. If you go to the website, you'll be easily directed to the app. It's a great place to start just keeping track of biomarkers if you've never done that before. Okay, and it's very user-friendly. It's pretty simple. There's a nice library on there that explains, kind of gives you a quick description of the different biomarkers so that you can at least get started and get familiar with starting to track your cycles and knowing what to look for. So I highly recommend, if you've never tracked your cycle, if you don't even know where to start, download the app, play with it a little bit, take a look at it, read around on it, see what you think about it, okay? Ulrika or I can be resources if you have some questions about that. The second thing I would say is that formal learning with a trained instructor, whether it's a FEMM trained instructor or a different method of fertility awareness, that combination is the best for the outcomes of either identifying your health patterns or achieving or avoiding pregnancy. So working with a trained fertility awareness instructor, we happen to be FEMM. We are biased. We love FEMM. That is going to be your best bet as far as understanding how to interpret what is going on and to ensure that you're actually charting correctly, right? Because you're doing all this work to collect data on your body. So we want to make sure it's good data collection, because the application of that data is for potentially medical care. So if there's stuff you're seeing in your cycle, if you're charting along in the app and it's like, hey, you should talk to an instructor, or hey, you might want to talk to a physician, medical care is available. And that medical care is very much guided by your charting, which is a beautiful thing. So there is application for the charting in a medical realm. And obviously you guys have seen that. We went through a couple case studies where you see that application. So there is so much utility to paying attention to your biomarkers, learning how to chart them in a standardized way. And this will honestly empower your healthcare options and the decisions that are offered to you in a medical sense. If you guys have ever been to a gynecologist and just walked out feeling really defeated, or a physician and walked out feeling really defeated, that should not be the interaction that you have with the healthcare system. We want to make it proactive. And just owning that information, understanding your body is one way to really hone that in and take charge of that. So we just talked a whole lot. Again, there's websites. I will email you with some of these links so you don't have to like take copious notes. We will make it available to you and easy. But we just talked a whole lot, and I want to take some time for questions in just one sec, but I'm going to stop the recording here. And again, we're just so grateful that you guys are with us right now. So again, thank you for listening and tuning in. This is a free resource that we, Ulrika and I, just are so grateful to offer at TrueFem.